our local hospital sold in 2013, and I was with the hospital at the time, and I converted the hospital, the proceeds from the sale of the hospital, to a community health foundation, commonly referred to as a conversion foundation. And at the time, the charge is really to take the monies that were the proceeds from the hospital, invest those, and take a portion each year and reinvest into issues that impact the health of our community. So I'm going to kind of fast forward briefly through that. What we have seen largely at the work here in the foundation, mental health concerns, as a lot of communities in our region and certainly in our nation are seeing, chronic illness, risk management, a lot of social determinants of health issues that exist within our community. We see poverty kind of threaded through all of those. Not necessarily as causation, maybe a little bit more in terms of correlation, but that is one of the common themes that we see is, and not even so much poverty, but under-resourced families within our community. And our foundation serves 4 counties in the western Upper Peninsula of Michigan, Baraga, Houghton, Keweenaw, and Ontonagon counties. And, the rough numbers are about 21% of people that are living in poverty, and about high 40s, almost 49% of people that are living at the ALICE rate. So we have a fairly substantial amount of friends and neighbors that are really asset limited families, under-resourced families.
My name is Mike Stieber, and I run our Bridges Out of Poverty program in the Copper Country here in Hancock, Michigan. And we service 4 counties in the local area, probably around 45,000 people. And I'm a retired educator, and I started working here in July. And I know that the Portage Health Foundation began, I believe, in 2013 with the sale of our local hospital. And it's a nonprofit organization that has expanded over the years. And I know about 2 years ago, the folks at Portage Health Foundation went to a Portage Out of Poverty workshop and got very excited to get it started. Wanted to start 2 years ago, but in regards to helping our community, we had a tremendous flood here.
What happened there, Lynn, is as our foundation actually responded to that flood, it gave us an opportunity. I think one of the benefits of that for us, as we were able to turn into a benefit, was it gave us the opportunity to interact much more intimately with a lot of the families, a lot of under-resourced families. Some of the neighborhoods that were most substantially hit were old neighborhoods, centuries old housing stock, that type of thing. And it just gave us an opportunity to really see more firsthand, not only some of the challenges for those families to recover from such a devastating, natural disaster, but also some of the, generational issues resulting from being under-resourced, poverty, and how that translated into a number of different health risk factors for those families and the communities. We started looking at some of the, disparities in life expectancy and chronic illness from community to community. And it just became even that much more emphasized that we needed to do something to address that need within our community. It was shortly after the flood that we were invited to a Bridges community orientation session that was presented by Treasurer. And we had prior to that, for a couple months, had been researching a couple different programs that address poverty and just different equity issues within the community. And myself and a couple staff members attended that orientation session. And I just, frankly, we had a get out plan for noontime. If this is a boring session and we're not getting anything out of it, this is kind of our bug out plan for noontime. And it was about 10:30 that morning, and one of my coworkers looked at me and they're like, "This is awesome." And I'm like, "Yeah, we need this. We're going to spend a day. So much for lunch plans. We're going to spend a day and learn a little bit more about this." And I bring that up because, for me, who can be somewhat skeptical and pretty critical of the things that I see, especially when I'm going to a learning event like that, it just became so painfully obvious that there is such a practical base of tactics within the Bridges program, And it was very easy to see for me to see how this would be applicable, very practical and very applicable to our community. And that led us to explore the program a little bit more. And then we went to the annual conference in San Antonio. One of my board members, actually our board chair, and a couple staff members had attended that. And again, we were just floored by the grace of everybody that was in attendance, the willingness to share information, to a lesser degree, because I'm not necessarily a very emotional person, but the emotion that was evoked by the success stories and the challenges that were overcome by many of the people that were investigators of the program, and just the shared level of success that everybody that was involved in the program, whether they've been a community facilitator or one of the success coaches or one of the investigators, and certainly the folks at Bridges, at AHA Processes, yourself and Ruth and Phil, everybody was just very open, very accessible. And it just made it very easy for us to better understand the program and how would we be able to bring this back to our community to apply it. So then, we were dealing with the flood and then we were dealing with COVID. So it took us about 4 years to actually get to a point where we could get a staff member on hand. I didn't want to do it piecemeal. I wanted to make sure that we put the resources in place correctly. And, and that was one of the things that really sold it. I was listening to all these success stories at the conference, and I'm just thinking to myself, we don't have to worry about who's going to sponsor a class or who's going to help with the meals or how we're going to fund the curriculum. Our foundation can do that. And I don't say that just, arrogantly or in any place of vanity or ego. I say it because, we are very fortunate to be able to have the financial resources to support the launch of the program and to have the human resources needed to support the launch of the program, which I think will just help accelerate the implementation and the execution of it. And we're just very grateful to have the support and the curriculum and everything that's needed. And that's kind of what brought us into this. We see this as a need in our community. We see it intertwined in virtually all of the other areas that we're working through as a health foundation, trying to address the different and variety of health risk factors that impact our region. And we're just incredibly grateful. And I think we're off to a pretty good start with our first cohort of investigators that are in the class.
Things are moving pretty fast. As far as I'm concerned, we've done a lot of planning, a lot of work. It was really difficult to get people to apply for our first Getting Ahead class. That was an obstacle that we had to overcome. And so we invited a lot of agencies to come in for a meeting and we talked to them. The workshop that we had was a couple of years ago. So some of the fire had died and some of the people that went to the workshop didn't know about the Bridges Out of Poverty program. So we sort of had to go door to door to get people to apply. But we did. We had 14 people apply. We interviewed them and we kept 9 folks. And tomorrow night will be our 9th Getting Ahead class. So we're right in the middle of it. And we started with 9 and we're down to 8. We had one gal that just is not stable enough to make it to any of the classes on a regular basis. So we'll invite her to come to our second one in August. But yeah, we're underway. We have our steering committee developed. We've had 2 steering committee meetings. We're in the process of making plans for August for our second Getting Ahead class. We're going to try to get a Getting Ahead while Getting Out class and also a Money Matters class. Hesitant of that, but it is falling into place. So
Good. Yeah, that trust the process sometimes people aren't sure about.
Especially if you're a teacher for 30 some years. I mean, it was really hard not to teach or to tell folks what they needed to do or what the answers were but facilitating a class has been a wonderful experience and it does work.
Of all the investments that our foundation could have made, and we've made a lot. I mean, we've invested close to $20 million back into our local community in the last 9.5 years already, through a lot of different areas. But I think that this is probably going to it certainly has the potential to do the most good for the long term for our community. And I say that without any hesitation because I see in our first cohort, we had 9 women, just happened to end up that way. One of which dropped out very after the first week for very legitimate reasons. So we maintained, good attendance, but I've seen how much this process, and I remember chuckling because everybody kept saying, trust the process. And I'm like, yeah, we'll see about that process, And I'm sitting here, and if anybody's watching this, you have to trust the process, because we're already seeing in week 9, 7, 8, 9, dramatic shifts in the things that our investigators value. It's almost like a cognitive behavior model, but it's changing the way that they value a lot of things. But more importantly, I think it's changing their own self-worth, their value, and their perception of their self.
Right.
We're seeing them just carry themselves differently already. They're advocating for themselves differently already. The nature and the content of our conversations, and I show up on the nights and I help with the meals and just kind of behind the scenes helping while Mike and Mary Jo are doing the classes, because I think it's important that the participants in the program, the investigators, know that there's a community of support behind them that they might not even realize is there. But I'm so assured of the importance of this program, and why I say I think it'll be the most impactful investment that the foundation has made is because in this short time, we're already seeing a change in those participants and, their aspirations and some of the steps that they're taking to advocate for themselves, to apply for college. 8 weeks ago, that wasn't even an option. There wasn't an option to even consider school, let alone now that it's not only an option, it's something they're looking into, and they're realizing that there's resources out there that will help them achieve that. And if that can happen in 2 months, 1 night a week, what does that look like in 3 years from now, when we've had a half a dozen or 10 cohorts go through, and we are also introducing the Money Matters courses, and we're also able to bring in the rest of the community to start participating in ways that they're not right now. I'm so very excited about where this is going to take our community.
We have our first workshop planned for May 18th.
Okay.
And that will be for our steering committee, our board, and a few other people. And then we're going to provide an area-wide community workshop June 6th. And so we'll probably have over 100 people at that workshop. But yeah, I think we sort of started, I don't know if we started backwards or what, but I think once we get the workshop, first of all, the word of mouth is already out there.
Yep.
The investigators are already talking with their sisters and their friends and their relatives that should take this class. But I think once we get the workshop out there and we put some emphasis on what this is all about, I think it's going to take off like wildfire.
And help collaboration in the community. I'm sure you're already seeing some of that, but I think you'll also see it really deepen as you continue to get the information out to community members.
Yeah, and we just have such a wonderful community. I think it's just a matter of, just a matter of time. The hard part is waiting, and I guess I shouldn't be too impatient. We just got started, but I know Kevin's always telling me that it's going to take some time, but I'm anxious to get that collaboration going sooner. We've had 6 or 7 people come in and talk to our class for no more than 20 minutes, but those connections have already made a tremendous impact on our investigators' lives. We have 5 of our gals that they're already making changes in their life because of those connections. So, yeah, I think once we get the workshop out there, we'll have a little bit more collaboration. It should be pretty amazing to see the results.
Which we're all anxious to hear about, and updates hopefully you'll provide for us in the next year or two.
Sure.
Are you the only one that's doing this work as far as with the Health Foundation? Do you have a team?
There's another gal that helps me. Her name is Mary Jo. And so she and I co-facilitate the class, and she does a lot of the work behind the scenes as far as getting the class ready. And we have some of our staff members will come in and help with dinner. So we have a dinner. We provide a $25 gift certificate to the local stores around here. We provide a $25 gas card every time they show up. And then we also have childcare. So we have great facilities, and our one of our local churches has really helped as far as like providing the facilities. And so yeah, but right now it's just that's one of my obstacles that I'm trying to overcome is I want to try to get more people trained as facilitators.
Mm-hmm.
So we're in the process of trying to put out a posting to see, because I know we may have one or two of our graduates that could be a facilitator.
Yeah, that'd be great.
And I'm still waiting to see if I can if there's somebody that'll jump out, because right now it's still a little iffy in regards to that. But I would like to get at least one more facilitator trained. I think there's a training in June that I'd like to have at least so that I could expand. I'm really hoping that I can get into the local jails and provide the getting ahead while getting out, while we have another getting ahead class and do two at once.
Yeah.
So that's my goal.
And as you're meeting with the steering committee, are they talking about future plans? What's in the future?
It's funny that we have not got to the point where we're talking about the future with them so much. We've had two steering committee meetings. The first one was just to get to know each other and see if they're interested. And the second one yesterday, or last week, I should say, we ended up talking about policy and how we need to change policies, which I thought was pretty powerful already. And I thought, well, so now we're in the process of collecting some information of some of the obstacles that we're seeing that folks are running into so that we can start working on changing some policies. As far as, let's see, what else can I tell you? We did have some conversation about trying to get a car loan program going with one of our local banks. So that was discussed last week a little bit. And so we're trying to make some connections, and it's just in the planning stages right now, but we'd really like to do what Muskoke's doing in regards to offering a small loan to folks where they can repay it and get themselves a reliable car. So we are talking about that a little bit.
Good. And again, as things grow and word of mouth gets out, I have a feeling you're going to be getting some phone calls and visits from different places and people saying, hey, here's how I can help.
I think so too. But like you said, it's just a matter of getting the word out because it's still so new. I really think once we get a couple of our workshops completed, then I think it's gonna be like wildfire because we just have a great community and there's just a lot of people that want to help.
Wonderful. And it helps too. Like you said, the community is one that's willing to listen and to help, and that will continue to make things grow for you.
Yeah, for sure.
First thing, life is going to throw a lot of obstacles in your way. Be resilient, follow through with this. Make sure that you take the time to do it right and understand it. And, I think the community will be better off for it. The other thing that I would tell folks, take advantage of the network of people that are out there. I've done a number of conferences, and through my career over the last lot longer than I care to admit how many years it's been that I've been in the nonprofit sector. But I've met few groups as a true collective that are as compassionate and as caring and willing to give up of their time and themselves and their experiences to help another community develop. We've been just overwhelmed with the grace and camaraderie, a lot of cheerleading. We've had a lot of people cheerleading us along this journey that have recognized that, and take advantage of that. Use that to empower your own communities, and sometimes use that to kind of infuse yourself with that next little step of motivation that you need to stay resilient to a lot of the other challenges, because we've certainly had our share. And like a lot of communities, especially those that are trying to do better for their friends and neighbors, there's always things that'll get in the way. Just take advantage of the resources and the support that's there. It's been a game changer for us because we've had a lot of opportunities and a lot of good reasons to give up on this, and the right people and maybe a little bit of divine guidance along the way. I'm not really sure, but it's helped us stay on track and stay persistent with this.
Good. Thank you for sharing that. And it's true. We do like to share with one another and teach, bring lessons learned.
Yeah, that's been very evident.
good luck. We will be back in touch. I'm going to want to hear updates, and thank you for putting this in motion and in play and making sure that people's lives actually are, stabilizing and the community can move forward.
You are welcome, and thanks for taking the time to talk to me, Lynn. I appreciate it.